I think the Murdoch has really, pivoted their research into COVID space, and there are so many different projects trying to help understand what this virus is and how it's behaving. But I'd like to share with you, a couple of things that I'm involved with, and Dave and I actually looking at this together, and we're really trying to harness the power of some of the research that's already been done. So we're taking families who are research-minded families who have been terrifically involved with the Murdoch for a long time in these big, what's called cohort studies, which may have been looking at, for instance, allergy in the population. And now we're going to go to them and ask them if they would be happy for us to look at their children over this period of the COVID period. And we really want to understand why children are responding differently to adults, and to begin to understand why there's this increasing gradient of severity and susceptibility from children as they age right up into adults. And so we're going to be looking deep down at the immune system. We've got bloods already on most of these children from before the pandemic, and then we're going to be looking at them, both the impacts psychosocially and on schools and learning, and the impact on families, and also what's happening at the cellular level inside their immune systems. And interestingly, many of these children may not exhibit infection. As we mentioned, they may be asymptomatic, but they may end up having some long-term issues associated with acquiring that infection, even though they didn't exhibit the symptoms. So we'll be looking very closely at children across the ages. Another project that I've been involved with is very exciting. It's looking at prevention of COVID through the use of a vaccine. And this is called the BRACE trial. And many of you may have already heard a lot on the media, and Professor Nigel Curtis is leading the BRACE trial, which is really trying to repurpose a very old vaccine, the BCG vaccine, which has been used for 100 years for prevention of tuberculosis, and trying to use the off-target or the non-specific effects of this vaccine to enhance the immune system over this period. So it's trying to train the immune system by giving healthcare workers, by randomizing them, giving half of them a BCG and half of them not, and to see whether this might protect those healthcare workers both from infection and potentially severe infection. And that study is enrolling 10,000 participants, with the Bill and Melinda Gates funding this, and WHO endorsing this trial. And that's not just in many sites within Australia, but also in Europe and in South America, and that is very exciting to be part of. The BCG is a live vaccine. So this is different to many of the vaccines that are given in childhood, apart from things like the measles, mumps, rubella and the chickenpox vaccine. Those are also live vaccines. But we know the BCG is particularly good at stimulating a non-specific immune response. So it's not targeted just to make an immune response against a particular bug, but it creates a general immune system response. And this is why it's being harnessed in the BRACE trial. But certainly there are countries around the world where BCG is given to infants, and potentially that may protect some of the infants in the poorer countries where BCG is given routinely. But BCG is not given routinely in Australia, and we can't be sure that it does have any protective effect, and that's why we're doing this study.